Good afternoon. I'm Dr. Brian Shapiro, a scientific writer at ATCC. Thank you for joining us for the latest installment in the ATCC Excellence in Research webinar series. The webinar is entitled Track THP-1 Monocyte Signal Transduction with a Bigger, Better, Brighter Signal, presented by Brian Della Fera. Mr. Della Fera is a biologist at ATCC. In this presentation, Mr. Della Fera will provide an overview on ATCC's THP-1 luciferase reporter cell lines, a new tool for the development of immunomodulatory drugs and biologics. After the presentation, we will be joined by ATCC Director of Biological Content, Dr. Feng Qian, who will help answer your questions. If you have any questions for our panelists, please use the chat function available through the webinar program. All questions will be answered as time allows at the end of the presentation. The recorded webinar presentation will be archived on the ATCC website, www.atcc.org. So with that, I'd like to welcome our speaker, Brian Della Fera.
Thank you, Brian, for that introduction. Hello, everyone. My name is Brian Della Fera, and I want to thank you for joining us today. First, a little background on ATCC. ATCC is a nonprofit organization founded in 1925 with headquarters in Manassas, Virginia, and an R&D and services center in Gaithersburg, Maryland. ATCC is the world's largest and most diverse biological materials and information resource for microbes. In Gaithersburg, we are an innovative R&D company featuring cell biology, gene editing, and advanced cell models, which is what today's webinar will be focusing on. Here is our poster that we presented at AACR 2020. This poster highlights the first two cell lines created for this portfolio, THP-1 NF-kappa B loop 2 and THP-1 gas loop 2. Information from this poster will be covered in today's webinar. A quick outline for today's webinar. We will first introduce THP-1 monocytes and the technology that went into creating the cell lines. From there, we will go over the development of the cell lines and finish up with some application data. Introduction to THP-1 monocytes and luciferase technology. In the introduction, we will be covering why there is a need for this product in the scientific community, do an overview of the use cases of these cell lines, give some background on the THP-1 cell line, the luciferase technology, and the response elements used to create the cell line. Over the last few decades, immunotherapy has emerged an exciting new approach for cancer treatment. This has led to a rise in the development of immunomodulatory drugs and biologics. This rise in development dictates a clear need for human cell-based models to evaluate immune modulation. Current evaluation methods are time-consuming, labor-intensive, or require expensive equipment. There is an obvious need for a model that can simplify the evaluation method for observing immune activity, while offering the flexibility to be incorporated into other assays. The THP-1 reporter cell line portfolio can be used in a wide variety of academic research and pharmaceutical R&D. These cell lines have been transduced with a specific response element to allow the studying of signal transduction pathways. The portfolio can be used as a screening tool for novel drug development by testing for innate immune response activators or inhibitors. They can also be used as a safety evaluation tool for new chemicals and drugs in the cosmetic, pharma, dietary, and environmental safety fields. THP-1 is an established cell line commonly used as a model in studying normal human monocytes. Since 2000, THP-1 is referenced in over 2,000 publications regarding immune modulation, according to PubMed, compared to 900 references for U937 and 400 references for UL60. The luciferase reporter system is a mature technology that is widely used in basic and applied research and development. The THP-1 reporter cell lines are a part of the growing catalog of ATCC material that utilize luciferase technology. Luciferase is a simple and reliable tool for monitoring specific cellular activity without the need of antibodies or fluorophores. THP-1 is an acute monocytic leukemia cancer cell line. The cell line is monocytic-like in nature, which makes it the perfect model for studying in vitro immune interactions. The cell line originated from blood leukemia. Originating from blood leukemia means the cells are at an earlier stage in the development pathway compared to other popular monocytic cell lines. This gives THP-1 the ability to be differentiated into primary-like macrophages or dendritic cells. THP-1 also benefits from a homogeneous genetic background over PBMC monocytes. This minimizes variability in the cell's phenotype, leading to reproducible results. The reporter system is a response element promoter site followed by a luciferase gene derived from fireflies. Firefly luciferase was first isolated and purified in the 1940s, and the gene was first successfully cloned into E. coli in 1985. Since 1985, the luciferase technology has been widely used in the scientific community as a reporter for cellular activity and gene expression. The transcription factor luciferase cassette is modified to have higher expression and quicker transcription compared to wild-type luciferase. This means a more intense bioluminescent signal and less incubation time. This assay system allows high-throughput screening of samples, giving sensitive readings and delivering reliable bioluminescent results. We selected a diverse range of response elements that encompass popular immune signal transduction pathways. AP1 activity is regulated by the MAPK-ERK pathway, which responds to a variety of environmental signals, cytokines, and growth factors. It plays a role in survival and differentiation. CRE regulates a diverse range of cellular response through the CAMP-PKA pathway. CRE responds to growth factors and inflammatory cytokines. It induces survival signaling in dendritic cells while promoting proliferation and survival in T and B cells. GAS and ISRE both regulate the JAK-STAT pathway. ISRE activity is controlled by type 1 interferons, interferon alpha and interferon beta, and GAS activity is regulated by type 2 interferons, interferon gamma. ISRE regulates antiviral response and modulates innate immune response. GAS is also a mediator in innate immunity and modulates inflammatory response. GAS activity is controlled by the calcineurin NFAT pathway. NFAT regulates the differentiation and activation of T cells. NF-kappa B activity is regulated by numerous cytokine receptors and pattern recognition receptors. NF-kappa B plays a pivotal role in inflammatory response. Next, we are going to cover the development of the THP-1 reporter cell lines. I will be going over the basic workflow of the cell line's creation, authentication, and verification testing. THP-1 cells are transduced with viral particles containing the response element luciferase expression cassette. The infected cells are selected out using antibiotic pressure. The transduced pools of cells is sorted and expanded. The clones are screened based on set performance criteria. Growth kinetic screening is performed on the final selected clones to choose the top performer. That clone is grown to create the pilot lot for commercial material. This process is done for all the cell lines in the portfolio. A big initiative for ATCC is our incredible 2020 campaign. One of the pledges in the campaign is to advance authentication. Authenticating our transduced THP-1 cell lines to parental THP-1 ensures our customers will be purchasing the product that is advertised. We STR profiled the final master cell bank material and compared the results to parental THP-1. All 6 THP-1 reporter cell lines have a 100% allele match to parental THP-1. Another measure of authentication is morphology comparison between parental THP-1 and the THP-1 reporter cell lines. On the left, we have a microscopy photo of parental THP-1 that has grown alongside the expansion of the master cell banks of the reporter cell lines. The right side is a selection of microscopy photos of the THP-1 reporter lines. The results show that the reporter cell lines have a similar morphology to parental. We run other authentication and sterility protocols to ensure the best product is available to customers. We run mycoplasma testing and bacterial contaminant testing, both with negative results. CO1 barcode assay is performed to verify the cell line is human in origin. We conduct verification testing to evaluate the performance of the THP-1 reporter cell lines. The first test is an induction curve. On the left, we have the THP-1 gas loop 2 induction curve. 5 different cell concentrations are stimulated with the same concentration of interferon gamma. The plate is incubated overnight and the bioluminescent signaling is read the following morning. The curve demonstrates the linear correlation between bioluminescence and the cell number. R-squared values for all 6 cell lines is greater than 0.95. Another verification test that evaluates performance is to test the stability of the bioluminescent signaling. This is done by keeping the cells in culture and once a week taking an aliquotis suspension and testing the signal. The cells are stimulated at a constant number and stimulant concentration. The figure on the right is the stability curve of THP-1 CRE loop 2. We set a design specification for the cell lines to maintain a minimum 10-fold change in expression. For THP-1 CRE loop 2, the cells were stimulated with forceline. The fold change in expression is greater than 10 over a 10-week period. This goal was achieved for all 6 cell lines. The stability testing demonstrates the consistent luciferase expression in culture. The application data and verification testing show we produced a quality product that can generate sustained performance for the customer's needs. Now we will move on to the application data of the THP-1 reporter cell lines. We will start with showing data from exogenous stimulation experiments. From there, we will move to a little more complex testing that includes small molecule inhibitors. To wrap up the application data, we will discuss a THP-1 proliferation assay using one of our THP-1 reporter cell lines. The first set of exogenous stimulation data is for THP-1 gas loop 2 and THP-1 ISRE loop 2. Both are activated by the JAK-STAT pathway. THP-1 gas loop 2 responds with high sensitivity to interferon gamma, which allows a high signal fold change to occur. This can be seen in the figure in the top right. We see a signal fold change of over 500 at 10 nanograms per milliliter, but also see a high signal fold change at lower concentrations. It is not shown in this figure, but we saw an inhibitory effect at higher concentrations of interferon gamma, up to 1 microgram per milliliter. The signal fold change remains similar to the 10 nanogram per milliliter dosage. We also found that interferon alpha and interferon beta can stimulate gas through crosstalk between STAT1 and STAT2 signaling. As you see below, this crosstalk phenomenon also applies to THP-1 ISRE loop 2. THP-1 ISRE loop 2 exhibits comparable sensitivity to all 3 interferons. This demonstrates the multifaceted nature of these cell lines. The next set of data shows THP-1 and FKB loop 2 and THP-1 AP1 loop 2. THP-1 and FKB loop 2 exhibits high sensitivity to stimulation of toll-like receptors and from pro-inflammatory cytokines. This can be seen with the figures of LPS and TNF-alpha, which is found in the top row. THP-1 and FKB loop 2 also responds to stimulation from common damage-associated molecular pattern. Here we showed HMGB1, a signaling protein associated with cancer death. On the bottom, we have THP-1, AP-1 loop 2. THP-1, AP-1 loop 2 demonstrates sensitivity to PMA, a potent formable ester. PMA permeates through the plasma membrane and activates PKC in the cytoplasm. THP-1, AP-1 loop 2 also shows sensitivity to LPS stimulation. The signaling cascade of LPS stimulation in the MAPK-ERK pathway is ancillary to the NF-kappa B pathway. The signal fold change is not as sensitive, but it is an indicator of AP-1 activation. The final set of exogenous stimulation data is for THP-1 CRE loop 2 and THP-1 NFAT loop 2. THP-1 CRE loop 2 responds with high sensitivity to forskolin, an activator of adenylyl cyclase. We see high signal fold change at 100 micromolar of forskolin, as seen in the top left figure. The fold change diminishes rapidly at lower concentrations. THP-1 CRE loop 2 also responds to changes in calcium ion concentrations. We demonstrate this by stimulating THP-1 CRE loop 2 with a consistent concentration of PMA and varying concentrations of ionomycin. PMA and ionomycin is a popular pairing for stimulating immune cells in vitro. This co-stimulatory reaction will cause the cells to increase their intake of calcium ions, producing a signaling cascade that activates the CRE response element. The NFAT pathway is also modulated by calcium ion channels. THP-1 NFAT loop 2 shows a high sensitivity to stimulation from the influx of calcium ions. PMA and ionomycin demonstrate a greater than 3,000-fold change in signal. THP-1 NFAT loop 2 also shows a high sensitivity to CON-A and ionomycin co-stimulation. Here it is shown a greater than 500-fold change in signal when CON-A concentration is 1 microgram per milliliter and ionomycin concentration is at 10 micrograms per milliliter. CON-A activates T cells and other immune cells by binding to the TCR complex, which subsequently increases the level of intracellular calcium ions. Next, we will look at examples of the inhibitory effect of small molecule inhibitors on the THP-1 reporter cell lines. The first example, we are looking at the inhibitory effect of CYT-387 on THP-1 ISRE loop 2. CYT-387 is a JAK1 and JAK2 competitive inhibitor. This will interrupt signaling via the JAK-STAT pathway. For THP-1 ISRE loop 2, it will inhibit JAK1. THP-1 ISRE loop 2 is stimulated with interferon alpha for 1 hour. CYT-387 is then added in a dose-dependent manner. The plate is read the following morning. The data is not shown in the figures, but basal control wells were prepared to calculate fold change. An identical plate is prepared, and the cell viability is measured to determine that loss of luciferase signaling is due to the small molecule inhibitor and not due to cytotoxic effects. Results show that CYT-387 has a dose-dependent inhibitory effect on THP-1 ISRE loop 2 until the concentration reaches 10 micrograms per milliliter, where it becomes cytotoxic to the cells. We tested CYT-387's inhibitory effects on THP-1 gas loop 2 as well. Type 2 interferons have both JAK1 and JAK2 in their signaling cascades. The protocol is the same as the THP-1 ISRE loop 2 experiment. THP-1 gas loop 2 is stimulated with interferon gamma. After 1 hour, CYT-387 is added in a dose-dependent manner. The plate is incubated overnight. Results show that CYT-387 has a dose-dependent inhibitory effect on THP-1 gas loop 2 as well, until cytotoxic effects at 10 micrograms per milliliter. Another example of the inhibitory effect of small molecule inhibitors is THP-1 NF-kappa B loop 2. BA11-7082 inhibits phosphorylation in the NF-kappa B pathway. The cells are stimulated with LPS for 1 hour. BA11-7082 is then added in a dose-dependent manner. The plate is incubated for 3 hours before bioluminescent readings. Again, an identical plate is prepared to measure cell viability. Results show an inhibitory effect on THP-1 and NF-kappa B LUT2 expression until BA11-7082 shows cytotoxicity at 50 micrograms per milliliter. The data in both the exogenous stimulation and small molecule inhibitor applications data demonstrates the THP-1 reporter cell line's potential as a screening tool for immunomodulatory drugs and biologics. The final application data I want to show is how you can use THP-1 reporter cell lines in a complex assay system. Here we will use THP-1 gas LUT2 to measure cytokine expression of stimulated primary CD8 positive T cells. Primary CD8 positive T cells from ATCC's catalog are seeded at 2 different concentrations in 96 well plates. The cells are stimulated using multiple reagents. Miltani max beads, anti-CD3 antibodies, and anti-CD3 and anti-CD28 antibodies are used. After 7 days of culture, supernate is removed from the wells. The supernate is cultured with THP-1 gas LUT2 cells to measure interferon gamma expression. The supernate is also evaluated by immunoassay to quantify the interferon gamma concentration. Interferon gamma is not the only stimulant in the supernate that could activate THP-1 gas LUT2, but with the high sensitivity that the cells have to interferon gamma, it is safe to say that a majority of the bioluminescent signaling is due to interferon gamma. Here we have the resulting data from the experiment. On the left, we have the luciferase bioluminescent signaling data, and on the right, we have the immunoassay results for the concentration of interferon gamma expression. The data shows a correlation between luciferase expression and interferon gamma concentration. The data exhibits the interferon gamma inhibitory effect brought up earlier in the exogenous stimulation data that is observed once concentrations reach 10 nanograms per milliliter. This experiment demonstrates the THP-1 reporter cell line's ability to be incorporated into more complex assay systems. We will now move on to the conclusion of this webinar. Videos are currently available for purchase at www.atcc.org. Feel free to also take a look at our other luciferase expressing product lines while you are there. In conclusion, the THP-1 reporter cell lines are designed to save the customer time and money. We took away the hassle and headache of running feasibility, development, and testing of the cell lines. We performed sterility testing to ensure the product is free of contaminants and that the immune modulation observed is solely from the experiment. We have shown that these cell lines are capable of studying signal transduction pathways by means of exogenous stimulation, testing the efficacy of immunomodulatory drugs and biologics with small molecule inhibitors, and is able to be incorporated into complex assay systems. We are excited to see how the scientific community takes advantage of these reporter cell lines in their research and the discoveries and products that come from it. For more information about these cell lines and our other offerings, please visit www.atcc.org/advancedimmunology. I would like to thank everyone for coming to today's webinar about our new THP-1 reporter cell lines. I will now take questions.
Well, thank you, Brian. In just a few moments, we'll begin our Q&A session. Please use the chat function available through the webinar program to submit your questions. The recorded webinar presentation will be available on demand on the ATCC website at www.atcc.org. And I can see that ATCC's Director of Biological Content, Dr. Fong Tian, has joined us. So welcome, Fong.
Hello, hi Brian. Hey everybody, it's nice to be here.
All righty. Well, let's go ahead and jump in with the first question that we have in. Quite a few have come in. For the different pathways, is the luciferase expression comparable, or do certain pathways display bioluminescence at a higher level than others? So, for example, does NF-kappa B give a brighter response to, say, the gas pathway, even though the stimulation is relatively equal?
I see. It's a very interesting question. I would say we probably shouldn't compare in that way. Just briefly introduce how those lines has been developed. So each individual cell line has been, went through hundreds of clone selection to pick the best signal-noise ratio-wise, the sensitivity and the stability. So each individual product has been screening out of hundreds of clones to pick the best one and individually verified and then tested to facilitate each signaling pathway investigation. So we haven't really compared between line and line, but I guess that's something that folks can do in comparison, but I guess vast majority of folks probably will be more interesting to looking the stimulation before and after, try to find a sensitive line to reflect the window of stimulation or blocker to investigate the perturbation, in fact, on the impact of any perturbation on the signaling pathway or your system.
All righty. Good. Now, this next question that's come in is about growth rate. So are there any differences in the growth rate of the parental THP-1 line versus the luciferase modified line?
Mm-hmm. Yeah, that's a very good question as well. So generally speaking, after genetic modification, single clone selection, we will encounter some level of growth rate slightly different, but just because we have so many forms and then we select and pick and balance. So overall, we have been setting up criteria allow that only a small window of difference for the final product. So for all those already released cell line or model, I remember all of lines have within 20% or 30% of a range compared with growth rate of parental. So in a very short version, they are very close. Growth rate wise, they're very close.
Okay, good. Now, I like this next question a lot because it actually addresses experimental design. Do you have any recommendations for control stimulus for the JAK-STAT pathways for, like, say, gas and ISRI?
Yeah, that's a good question. I think in terms of control, I would say that usually folks will use those to investigate interferon gamma signaling pathway, and then there's interferon gamma A, alpha, beta, and a gamma, let's say type 1 and a type 2. So a gas gamma is specific for interferon gamma. So certainly you can use interferon gamma as a good control. It's very sensitive for the stimulation comparison, and for the other one, it's alpha and a beta version. So I think either interferon alpha or interferon beta, or even you can use gamma as well. But I would say either alpha or beta can be good control.
Okay, good. Now, the next couple of questions that have come in look like they're around growth conditions. The first one is around media. Can you describe any medium differences between the modified cells versus the parental?
No, actually, I would say just because of the engineering approach, we do add pyrimycin selection to the media, the basal media and the complete media. Very much besides the antibiotic selection, it's exactly the same as the parental. So that's why it's very easy to use. Basically, all the cultural conditions maintain the same. In terms of adding antibiotic, also preventative of any unstable situation, but because this is lenti integration has been showing very stable, and on our end we have done significant amount of stability studies, so we're pretty sure the line is very stable, very consistent, but just precautionally to add antibiotic selection reagent in the media as well. So I think this is another conveniency for folks, just maintain the same condition as the parental.
All right. I like it. I like it. Now, the next question that I have for you is around plating. Do you know offhand what the cell number was that you were culturing the experiments at?
I'm probably gonna, need to double check folks how it works in the lab, but in my memory of review the data, I believe that dose has been tested a wide range. So starting sitting relatively lower density, for example, even lower as 5 up to 20 or 100K of sitting density, 100K, I mean 1,000 cells per 96 well per well. I believe they have been all working. Relatively speaking, probably 10,000 per well in 96 well plate is pretty optimal experimental condition. So I think vast majority of the experiment have done or shown data here is around 10,000 cell per well in 96 well plate. Certainly you can go beyond and a bit lower based on the experiment need and then your experiment titration.
All right. Oh, that sounds good. So here's another question that's come in around experimental design. Can the THP-1 luciferase cells be stimulated for longer or shorter than just overnight? And maybe to rephrase the question a little bit, would you want to try and I guess empirically figure out what works best first, or is just overnight optimal in all cases?
Well, that's a very good question. I think, again, really depending on your experiment condition and design and the perturbation or stimulant you're using, the timeline can be further optimized or can be different. But overall, we have seen that overnight have given you enough signal and consistently, relatively speaking, normally within the window of 6 hours to overnight, you can get good reading. When the stimulation continue to too long, certain responder elements or based on the stimulant as well might not, maintain the high signal anymore. And then shorter than that, you might not really see the high peak. But in certain responder elements and the experimental condition, you might see the signal actually can happen very quick. For example, NFAT in terms of testing, the T cell activation setting. It can happen really fast. So even 2 hours stimulation in terms of that, you can get really good signal. Okay,
I like it. I like it. Now, here's a general question about the portfolio, and I'm going to leave this open to you, Feng, if you want to talk to any about any new additions to our immuno-oncology in general portfolio. But are we looking to add more response elements to the THP-1 luciferase portfolio?
That's a very good question. I think at this point we have 6 responding elements, relatively speaking, have covered a lot of signaling pathway and a major, cytokine pathway for inflammation, etc. So at this point, we might, wait and see, and then also continue to hearing people's response, and then see if there's any need of adding additional. But meanwhile, I'd like to mention that we'll continue to building other product and the cell type. For example, in line with immuno-oncology or immuno-oncology, we're looking for using the luciferase reporter approach, responding element approach, to building some immune checkpoint reporter line that can read, the cytokine release in the culture environment. So that can be really powerful to investigate, if your T cell being activated by using checkpoint blockade, rather through the labor-intensive ELISA, you can use those system, very similar systems. So I think if you'll be interested in those additional products, then certainly checking with our website, and I believe we already have a set of a CAR-T reporter released, and the checkpoint reporter, which naturally express checkpoint molecule on the cell surface, will be available very soon as well.
Good. Okay. Now we've had quite a few questions come in, actually. So this next question that's come in, I feel like, Fong, you've maybe answered already, but how long are the cells incubated with stimulators before the luciferase signal is observed?
Right. So I would just say that, as one of the other question has mentioned before, I would just say you can start with the window 6 hours to overnight, and overnight sometimes it's work with everybody's experiment setting condition or schedule. Sometimes 8 hours can be difficult, or 12 hours can be difficult to work in the lab. So I would just say that within this window, any time could work. For the easy way, you can start with overnight incubation. And for the MFAT, I would encouraging to use a shorter time frame, 2 to 4 hours. Even 2 hours could work.
Okay. Good. Now, all right, here's another question. I am working with the THP-1 NF-kappa B-LOC2 cells. There's a question around the maintenance of the cell line. Is there any passage number after which it would not be advisable to use the cells? So maximum passage number.
Which shouldn't be advised. So I would say that almost like a contradict with what I said before. We have the product that tested intensively. It's very stable, and it has maintained high performance. But in general speaking, I would advise folks not trying to use high passage cells, just because the continuous culture too long time in the lab will increase the contamination, cross-contamination chance. And just because how you maintain in the lab, every time you might not be so precise and consistent. So somehow those variation in the culture environment also will impact on the behavior of the cells. So often we will recommend folks stopping to use after 15 passage, 10-15 passage, and then stopping using that, and then continue to get a new vial cell for testing. Certainly you can tailor to your situation, but if in a situation you have been culture cells for more than a month in your in your hood, that's probably is a sign you should be stopping and get a new vial to start work again.
Right. And then, of course, there's genetic drift and things like that, too. Okay. So for this next question, in the CD8 cytokine expression quantification data, why is the luciferase signal in the 100K stimulated is lower than the 1K stimulated condition? just compared with the ELISA data?
Let me think a little bit of data. So I believe that's the co-culture experiment mentioned. So I think when we're talking about CD8 positive, it's really a killer, right? The toxic killer. So when you have too many cells in the system, somehow can have toxic effect on the other component, so which will reflect, the cytokine release, not cytokine release, the luciferase expression release decrease. So overall, I would say that will be due to too much of the killer cells in the system, in a way of impaired the viability or the cell function. Even though the interferon gamma expression really high, released out, but the function of cells and the viability of cell itself will have will be impacted. So that's why you do see the fold change or the signal reduce.
Okay. All right. This next question kind of came in two parts. So for the first one, are the cells grown in suspension?
Yes.
Okay. Easy peasy. And then for the second question, for the last application, what's the advantage of the approach that we took versus taking the supernatant and doing an ELISA?
Yeah, that's a great question. So here, I think often when you do ELISA, it takes longer time. Often when you have enough concentration of cytokine release in the supernatant, you will need to culture the cell for multiple days. And then you collect the media, and then you do ELISA. But in this case, even lower concentration release in the cytokine release in the supernatant, and by using highly sensitive reporter assay, you can avoid all those troubles. So in the nutshell, it's very convenient, very consistent, and high sensitivity. So save your money and the trouble.
I like it. I like it. All right. This next question is an interesting question. If you stimulate the THP-1 cells with PMA to activate beta-2 integrin expression, how long does it take for the luciferase expression to return to baseline before you can test, say, whether an anti-integrin antibody induces signaling? And then they call it especially for the CRE cell line.
That's a good question. We actually haven't investigated that to see after the activation how long it would take the baseline, return to the baseline. It probably require a design of time course study collecting different samples, but yeah, it's a very interesting question. We haven't really looked into that before.
Okay. This next question, it came in two parts. The first part we're not going to address, but the second part, which luciferase is used as a reporter, and is the luciferase itself secreted?
Can you repeat the question? Sorry.
Sure, no problem. So which luciferase did we use as a reporter, and is it secreted, I guess, out of the cell?
Which has been so you probably have missing some of the presentation in the front. So basically, those reporters building in a way that engineering transcription responding element linked to luciferase into the cells. So they were sensing the environment change, sensing the release the cytokine in the supernatant. And for example, when you add other perturbation or cytokine or reagent, even general LPS for the different signaling pathway reaction, you will see the activation of your transcription factor responding element and the link to the luciferase signal increase or change. So by observing the window, you will, in a way, can quantify or measure what happened in your culture environment. So if you add perturbation, you have add cytokines, or in your culture system, the cell has released cytokine at a different time, different month. By using this reporter, you can sensing those change. So it itself do not really release anything, but it can sensing the release the cytokine in the culture environment.
Okay. And to this asker, we actually met him at a conference recently. We can talk about it offline also and answer your questions further. We're happy to reach out, back out to you.
Perfect.
All right. And so for the next question, how long are the cells viable in culture?
Oh, so
and,
sorry. Sorry, Brian, can I stop here a little bit as well?
Yeah.
Just going back with the previous question. So I would say yes. So in a way that luciferase can be read in two ways, actually. I was thinking about a different line of questions. I didn't hear it very clear. So actually, luciferase can be read in two different ways. That release, it can release, or you can lysis the whole cells. In this assay, we will, do the assay and use per-mega luciferase kit, the reagent, to lysis the cells and then give you the total amount. I would really encouraging use this approach to get the total amount of whole reading. In terms of release, really based on the cell viability stage or the timing, so you only get a fraction. So that might not really be so accurate to portray the whole signaling change or window you want to see. So I think that is just one thing I want to add.
Okay, good. No problem. Okay. I guess then we can move on. So and we addressed this question earlier, but how long are the cells viable in culture? And is there an amount of passages where you would see their expression level drop?
Mm-hmm. Yeah, I think it's a very similar question. I would say that one thing I do wanted to mention about those luciferase reporter, or generally speaking, THP-1, is that THP-1 is relatively more trickier than other tumor lines, a continuous line to grow. So often you will see, once you thaw the cells, you will see a dip. You will see the viability drop, and then it going back, and then probably going to take a few days to a week that you really see the viability coming back, and then have really super performance. So you might want to culture the cells, maintaining them, passage them for about a few days, a week, before you see, post-thaw immediate, or might not be immediate in your first testing, but within the first day, you may experience some viability drop. So I do want to ensure folks know that the best practice, you wanted to maintain your culture after thaw, passage them 1 or 2 times. When I get back to the optimum viability, starting to perform your assay. And now the cell, once you maintain this really healthy stage of cells, maintain the culture, it can be passaged multiple times. Even though I will still recommend to maintain within 10 or 15 passage for the optimum performance in your lab setting. And expression level drop. We haven't, by testing low and high passage level in our product development phase, we haven't really seen any expression level drop. So the line itself is very, very stable. But again, we often at ATCC maintain it in a way pretty straightforward, restricted to based on the protocol. So it's slightly different than in the lab setting. Folks might have some variations. So we were able to continue for a very long time and maintain the same level of performance.
Okay. Good. Now here's another interesting question. Does treatment of the THP-1 cells with PMA to differentiate them to macrophage phenotype affect the basic level of luciferase expression, controlled by GAS, ISRE, and especially NF-kappa B binding site containing promoters?
That's a very interesting question. That's a good question. I think we haven't tested that before. I know that by talking with some of our customers, people have been using our product, those luciferase reporter line, a few line at the list. They have done study that those THP-1 reporter can be differentiated into macrophage, continue to have the high performance as a reporter when they perform experiment to testing the different stimuli or perturbation in the experiment condition. So I don't exactly know if the basic level, the basal level will stay the same, but I assume that by hearing the feedback, at least the window, what the sensitivity before and after the perturbation or stimulation, you still see or you will see very much the same level of sensitivity or window performance. So I think that's probably even more important. Even the basal level changed, but the sensitivity around unstimulation versus stimulation should be still stay the same, at least based on the one of the academia research lab have done those products that differentiate into macrophage, have seen that.
All right. Okay, and we have one last question that's come in, so we can kind of do last call. So I'll answer this. If any others come in the next few minutes, and then we can close. But Fong, is this something that we do? How frequently do we regenerate, quote unquote, the cell line by selecting single cell clones?
I would maybe try to guessing the regenerate meaning. Maybe put in the two scenario. Usually when we do genetic engineering, vast majority of time we are using single cell cloning approach. So we do believe that when you do genetic engineering, after manipulation, you will have some high performer and a low performer in a mix of your pool. So we aim to select the best performer and maintain the stability. So we often through single cell cloning approach, we might have a few products in the past, it's a pool, and then could potentially in the future we'll have some model which single cloning just not be able to perform, or in a way the cell just not be able to survive through single clone approach. We might consider just take it as a pool. So in a way of how frequent, I think vast majority of time in the engineering approach. Now, if without engineering approach, if we just simply say, okay, we have a traditional classical cell line, could we use single cell cloning approach to regenerate a new cell line? Yes, we can for sure. And we have some case around that. but it's not so often, just because I think the established cell line have so much information publication associated with. So people are often want to have the existing line so they can reproduce the result. So in some case, if we find the existing line or continuous cells have quality issue and then just have too many genetic drifting through the years, and then we will re-engineer those lines and produce different version by select the optimal clone from the original cell lines. Again, this is in the context of no any manipulation, genetic engineering purpose, just try to give the new life of some trouble-ish continuous legendary line. So I hope that answered the question.
Nice, nice. All right. Well, that is all the questions that have come in except for one, which I will go ahead and take. Will the webinar recording be available to view later? And the answer to that is yes. The recorded webinar presentation will be available on demand on the ATCC website at www.atcc.org/webinars. Simply navigate to that page, click on 2022, and scroll down to find this and many other webinars. So at this time, we will conclude our Q&A session. I'd like to thank Brian for the excellent presentation, and thank you, Fong, for being a panelist. We do have some related events. If you're at SITC 2022 conference this week, please be sure and drop by our booth 313. We also have a couple of scientific posters that our scientists are presenting. Ha-Yun Chong will present her work on a PD-L1 reporter cell line based on the immune checkpoint protein profiling of ATCC cell lines. And John Folk will give his talk describing how a luciferase reporter cancer cell lines facilitate CAR T development. We hope to see you there. Thank you everyone for attending this webinar, and have a great day.